Drug users in the United States have consistently shown an elevated incidence rate of hepatitis A, B, and C when compared to the rest of the population. My name is Mason Williams, and I'm going to discuss the current state of this problem as well as potential solutions.
Hepatitis is an infection that causes inflammation and deterioration of liver tissue. The body's immune system attacks its own hepatocytes and often leads to jaundice, vomiting, stomach pain, gastrointestinal problems, and liver swelling. Since the liver filters the body's entire blood supply, any damage to its function is a call for serious medical attention. If left untreated, hepatitis is life-threatening due to the decreased liver functioning and the organ's inability to properly filter blood.
Hepatitis is named after the virus that causes it. It has three main variants, including hepatitis A, B, and C. These variations are shortened to HAV, HBV, and HCV. All versions of the disease are life-threatening if not medically addressed. In 2016, the CDC estimates a total of 4,000 new hepatitis A cases, 20,000 new hepatitis B cases, and 41,000 new hepatitis C cases in the United States. Contact with other infected individuals, especially sexual contact, along with alcohol consumption, IV drug use, and infection during pregnancy, are the leading risk factors for infection with hepatitis viruses. Special populations in the United States show higher prevalence rates for hepatitis infections. IV drug users are at very high risk for developing some form of hepatitis, although they most commonly develop hepatitis B or C. The high prevalence of infection is due to unclean needles inserted directly into their veins. Drug users have tendencies towards unsanitary injection practices for several reasons. First, they simply lack the knowledge of how to carry out an IV injection safely and cleanly. Second, drug users do not have access to clean needles and syringes. They end up reusing syringes and needles until they no longer function, despite the labels indicating the needles are one-time use only. Third, drug users tend to be amidst a population with higher hepatitis infections as a result of unsafe sexual practices or from infection at birth. When one person infected with HAV, HBV, or HCV uses a needle, the needle is often able to transmit the disease on contact. Since many drug users are unaware of their infected state, they share needles and infect others unintentionally. The population of drug users with hepatitis has developed in conjunction with the opioid epidemic. Opioids have become increasingly easier to access in recreational situations, which gives this epidemic a spot on the list of public health issues to address. Heroin is one of the leading opioids running rampant in the U.S. streets and happens to also require intravenous injection. As heroin becomes easier to access and knowledge about side effects remains minimal, needle sharing and personal contact during drug use encounters increases the hepatitis cases in the United States. Controlling the availability of opioids taken through injection in the U.S. is the indirect goal of controlling drug users' hepatitis cases and vice versa. Managing hepatitis infections is a lofty task. Many of the hotspots for hepatitis infections involve users who have no insurance, no access to health care, or are not concerned about their condition. The users are often addicted and have no tolerance for treatment and are uncooperative with workers trying to help. Community-sponsored drug addiction treatment efforts are an attempt to not only treat the overarching problem of drug addiction, but they are largely trying to treat the health conditions resulting from drug use, with hepatitis being high on the list of problems to address due to its poor outcome and high communicability. Antiviral medications are available to help delay the growth of the hepatitis virus. However, the patients who need these medications are the ones with the fewest means of accessing them. Few drug users with hepatitis are established with a primary care physician or specialist who can help them get the medications they need to treat their hepatitis or help them overcome their drug addiction that led to the infection. A possible solution to this problem includes making these medications free to patients who first, agree to come in for regular checkups at a clinic, and second, cooperate with a treatment program to simultaneously treat their drug addiction. This solution is expensive since the patients may be unable to pay and would rely on government-run insurance programs, but working to get past the opioid epidemic and lowering hepatitis cases starts at a small scale. In an attempt to control costs, the program can employ fewer physicians in favor of more nurses with advanced degrees, PAs, and therapists. These clinics could also work to vaccinate users who have not been infected. An article released in early October 2018 described a Philadelphia neighborhood's attempt to limit drug use. Kensington, Philadelphia is known for its heroin and lack of control of the problem. The city's Department of Health announced that it would encourage, but not financially support, organizations to set up safe injection sites where drug abusers could inject safely and under the supervision of a medical team. The sentiment behind the injection sites is simple safety, but at the root of the movement is education and understanding. The sites can encourage users to recognize the dangers of disease transmission that arise when they use drugs. To extend this idea further in the future, the injection sites could partner with a screening center for hepatitis and allow patients to voluntarily get checked for hepatitis infections and receive guidance and treatment as long as they comply with the program to help them overcome their addiction. The United States has several steps to take in an attempt to treat this problem. Vaccinations need to be readily available in a no-strings-attached manner, so patients who voluntarily get free screenings for hepatitis and are found to test negative can receive vaccinations at no charge and without any requirements for follow-up or addiction treatment. At the heart of the population of drug users with hepatitis is a lack of access and education. Users don't know of their infection, don't have the means to see a physician who can help them with treatment, or are so addicted to drugs that they are unable to comply with treatment even if they try. As patients, they feel shame and often don't have the necessary social support system needed to combat addiction and infection at the same time. But what can we do? Patients with hepatitis and drug addiction often have no means of payment. How much, if any, free treatment should these patients receive in the interest of overall public health? And are safe injection sites like the one in Kensington a good idea? Some people argue that it encourages drug use, but how could this encouragement be limited and the centers instead focus more on education, treatment, and prevention through vaccination?